So we're going to talk about pain in dancers, right? This is a very, very complicated subject, as you well know. You've already. It depends on so many different factors, but we often think about good pain versus bad pain in dancers, and they often ask, what's the difference between good pain and bad pain? Well, immediately you think about bad pain is pain following an injury. And you have to think about several questions that you ask yourself with this. We ask the dancers, could you get up and bear weight after the injury, after you fell? How long did it take it to heal? Because if it's hurting for more than about 5 days, you probably should see somebody and get it worked up and find out why it isn't healing. Especially pain with sort of normal activities, like pain with walking that doesn't get better, something could be wrong. Especially if something moved out of place, like a kneecap that slipped out of place or a shoulder that slipped out of place. That needs to be worked up by a doctor. And the main thing is pain that isn't getting better. I mean, you can't go running to the doctor and see somebody every time there's an ache and pain, because with dancers, there's usually the daily pain. Something hurts a little bit every day, and that's probably normal. But if it hurts for a very long period of time, then it should be looked at. Then there's the pain that comes on without an injury, pain from overuse. And it can be anything from a possible stress reaction or a stress fracture, but the same criterion applies. You want to give it a reasonable length of time to get better, but if it doesn't, then you need to go see somebody and see why it isn't getting better, because there may be something wrong. And there's also the other factors in this. The factors related to the type of body you have. For instance, hypermobility is associated with low pain thresholds. And this is a study that is done that showed that hypermobile people needed more anesthesia in the dentist's office, for instance. And so there are all different kind of factors that go into this. Anxiety is a factor in producing pain. And anxious people tend to feel pain more. Then in the worst case scenario with pain, there can be disabling pain. There is a thing called RSD, or reflex sympathetic dystrophy, complex regional pain syndrome. This is severe pain, and it can come on with a minor injury, just a simple contusion or something. And that's where all the pain management people come in to manage that kind of pain, because that is very, very serious. But that's not usually what we're talking about. That's not something that occurs often in dancers, because dancers tend to be stoic. They tend to hide their pain and self-medicate, which is another problem. The taking drugs or medicines to handle pain is not always a good idea, because for several reasons. One, they may be artificially taking away a signal from your body that's telling you there's something wrong. I tell my patients that pain is usually Mother Nature trying to tell them what she wants them to do so whatever they have can heal. The cop-out is to temporarily take the pain away and then go do something that would hurt you if you weren't taking the pills. This is what often happens, especially in athletes. So that's not a good approach to things. And there's some science recently that shows that inflammation is an important part of the healing process. And to artificially take it away with a pill may actually be impeding the healing. And they say now that you shouldn't give anti-inflammatories to treat a fracture, because you're going to slow down the healing of the fracture. So that's very complicated, the use of anti-inflammatories. And I hate pills. I really do. It's okay though if you've got a minor something that hurts you every now and then. Sure, it's okay to take some Advil or something like that, but you shouldn't take those on a regular basis. And they can be damaging, and usually you build up tolerance for them anyway. And there are even cases of anti-inflammatories with severe hydration that have caused kidney failure in professional athletes. So it's not a benign thing, those pills. I don't know. But it's there for a reason. I mean, and to simply artificially take it away is not a good thing. It's the initial part of the healing process. Not good. Human nature, though, you know, I don't want to deal with this. I'll take a pill and I'll feel better, and then I don't need to deal with it. You know, that's human nature.
Now, the dancers, do they come to visit you for problems of pain or because they can't dance?
Well, that's part of it. I mean, because that's when they usually finally come in. When it hurts so much that they can't dance anymore, then they come see you. But they don't come see you when it's just hurting. That's the classic stress reaction leading to stress fracture. It hurts, and the reason it's hurting is Mother Nature is trying to tell them that something is wrong. And finally, if it goes to a stress fracture, she says, okay, you're not listening to me. I'll make it hurt so much you can't even walk. And then you'll stop and do what you need to do to get this healed. It's not nice to fool Mother Nature, right? She's very accurate about telling people things.